Good morning, everyone. My name is Maya Luria with TMC for Seniors, and today we are going to be speaking with Morgen Hartford. Morgen is with the Alzheimer's Association right here in Tucson, and he's got a lot of important information to share with us today regarding COVID-19 and caregiving. And he's got several tips that are going to be really helpful, I think, for folks, especially as we're at home right now, and it's been a real challenge for everyone. You may be watching us today on either our YouTube channel or our Facebook, our seniors Facebook page. And if you've got any questions, please feel free to leave them in the chat box, and we will answer those at the end. So I want to welcome you, Morgen.
Thanks so much for having me this morning.
Yeah. So, Morgen, tell us just a little bit about what the Alzheimer's Association is doing here before we get started.
Sure, absolutely. So the Alzheimer's Association Desert Southwest chapter is one of many chapters of the Alzheimer's Association across the country, providing Alzheimer's care, support, and research for all affected by Alzheimer's and all other dementias, here both in Southern Arizona and, like I said, across the country. We've got programs and services like education programs like the one you'll hear today, support groups, early stage social engagement programs like our early stage music jam in partnership with TMC for Seniors, and many other programs and services. And of course, we are really dedicated to advancing research with Alzheimer's disease, and you'll hear a bit more about that today. If you're interested in finding out more, you can always go to our website, alz.org, and I'll tell you more about our programs and services throughout the presentation.
Great. All right. Well, let's go ahead then, and we'll jump right into the presentation.
Very good. Well, welcome to the COVID-19 and Caregiving program that's presented here by the Alzheimer's Association in partnership with TMC for Seniors. Next slide. We'll be talking today about COVID-19 and caregiving. And by the end of today's program, you'll be able to understand the relationship between COVID-19 and dementia, list tips for caregivers managing the pandemic, recognize the Alzheimer's Association resources that can help. And as we go through the program, we're going to encourage you to take notes if you have the ability to do that. And like Maya mentioned, being able to chat those questions as we go as well. At the end of the program, we'll have some time to answer any of those questions that you might have too. So let's get started. Research on the connection between COVID-19 and dementia is a hot topic right now, and it's one that's evolving. Now, early in the pandemic, we believe that dementia did not increase the risk for COVID-19, as you see on the slide here. But as research evolves, we're learning more about the effects of COVID-19 on dementia and risk as well. So just a few weeks ago in the Alzheimer's and Dementia Journal, the Journal of the Alzheimer's Association, there was a study published finding that the risk of contracting COVID-19 was twice as high for people with dementia than those without it. Black Americans with dementia were 3 times as likely to contract COVID-19 compared to whites, and those with vascular dementia appeared to be at highest risk. So while early on we thought the risks were particularly due to dementia-related behaviors, we see that some common characteristics of individuals living with dementia, including dementia-related behaviors, increased age and comorbidities like hypertension, diabetes, and cardiovascular issues may make the body and the brain more susceptible to infection. The breakdown of the blood-brain barrier may also explain this increased risk for COVID-19. These are early findings, and they're concerning, but more research is definitely needed as we explore this topic further, and we're dedicated to doing that research. Now, people living with Alzheimer's disease or dementia may also forget to wash their hands or take other recommended precautions to prevent illness. And we'll talk about some of the ways to mitigate those risks. But additionally, diseases like COVID-19 and the flu may worsen cognitive impairment due to dementia, and we're exploring the impacts of COVID-19 on cognition in the brain over a period of months and years. So interested to be able to report back on that data as we know more. Let's talk about some of the tips and topic sheets available for COVID-19 and caregiving. And the Alzheimer's Association has compiled some of these tips and topic sheets that can be found online at alz.org/COVID-19. And there you'll find tips for caregivers at home, tips for dementia caregivers in assisted living settings, tips for individuals receiving home-based services, what to expect if a nursing home has an incidence of COVID-19, and tips for staying healthy. Over the course of the program today, we'll highlight some of these tips. So the first we'll cover is tips for dementia caregivers at home, which is so common right now as people are still, hopefully adhering to guidelines and staying home as much as possible to reduce risk. And caregivers of individuals living with Alzheimer's and dementia should follow the guidelines from the Centers for Disease Control and Prevention, also known as the CDC, and consider these following tips. So people with dementia may need extra reminders for things like washing their hands. This could include written or verbal reminders for folks. We want to support the individual we're caring for while reminding them that the importance of hygiene practices from one day to the next is important aspect of keeping them safe. So those gentle reminders and habits and routines are really important. You might consider placing signs in the bathroom or around the house for people with dementia to wash their hands with soap for 20 seconds. You may need to sing the happy birthday song with your loved one with dementia, making sure that you're demonstrating thorough hand washing. And you may need to do that together as a team activity. Alcohol-based sanitizers with at least 60% alcohol can be a quick alternative to hand washing if the person with dementia can't get to a sink or wash their hands easily. Next slide. For people with dementia, increased confusion is often the first symptom of any illness. If a person living with dementia shows rapidly increasing confusion, make sure to contact their health provider for advice. Ask your pharmacist or doctor about filling prescriptions for a greater number of days to reduce the trips to the pharmacy. We know that increased exposure can increase risk for contracting COVID-19. You want to think ahead about making alternative plans for the person with dementia, adult day programs, respite care, etc. If those things need to be modified or canceled in response to the pandemic. We know that we've seen changes over time with partial reopenings and closures again, particularly in school settings, but also in other businesses and in care programs around for people with dementia. So it's important to pay attention to those guidelines and make some backup plans if needed. And similarly, you want to make sure that you think ahead or make alternative plans for care management if you as the primary caregiver should become sick. It's always important to have some backup plans. Is there somebody else that can assume care and help with those daily needs? So some tips for caregivers using in-home-based services. So even when precautions are taken, any outside person entering your home increases the risk of spreading COVID-19. The risk of exposure is greater for individuals living with dementia who tend to be older and have underlying health conditions like some of the ones I mentioned earlier. To help reduce the risk associated with in-home care, it's essential that you require care providers to wear a face mask or cloth covering when they're in your home. Recommended personal protective equipment should be worn when personal care and medical services are being provided. Really important. We know how effective masking can be. Make sure that they inform you if they are experiencing any fever symptoms consistent with COVID-19, or if they've been exposed to anyone with the virus. If so, they should not be visiting at that point. Make sure that they're washing their hands with soap and water for at least 20 seconds, both when they arrive and frequently throughout the day as well, especially after using the bathroom, before meals, after coughing or sneezing, etc. And you also want to make sure that they're avoiding eating at the same time as the person living with dementia as well, so that you don't have masks off and they're breathing in the same close proximity to the person with dementia. So let's talk a little bit about tips for caregivers of individuals in care facilities. Now, we know that this has been particularly difficult for family caregivers who've placed a loved one maybe before COVID-19 or during the pandemic, and visiting restrictions have been challenging. We see a gradual reopening here in Arizona, and as the vaccine continues to be broadly administered, we're going to continue to see reopenings. But it doesn't mean that we should stop being as careful or safe around risk management in those care facilities. So when we cover these tips for caregivers of individuals in assisted living settings or nursing homes, the CDC has provided guidance to these residences on infection control and prevention, both at the federal level and with guidelines at the state level as well. Now, the guidance is for the health and safety of both the residents and the staff, and looking out for family members visiting as well. And precautions may really vary depending on local situations. So if you're watching this outside of Arizona, make sure that you're checking your local guidelines as well. And the CDC has a number of resources on their website to be able to identify some of the local and federal guidelines as well. But some things that you can do would be to check with the residents regarding the procedures for managing the COVID-19 risk, and checking in frequently as conditions evolve. What risk management practices are they taking? Make sure that they have your emergency contact information in the event that they need to contact you, or maybe even the contact information as a friend for backup. And of course, you do not want to visit anyone in a long-term care setting if you've had signs or symptoms of illness. We want to be really careful not to spread the virus if we're visiting our loved ones. Now, depending on the situation in your local area, residences may limit or even not allow visitors. We saw this early in the pandemic, that visiting restrictions were in place. And this is really to protect the residents, but it can be difficult if you're unable to see your family member. And we know that that's been a particular challenge for families with loved ones with dementia in long-term care settings. If your family member is unable to engage in calls or video chats, make sure to ask the facility how you can keep in touch with staff in order to get updates on your loved one. If visitation's not allowed, ask the staff member how you can have contact with your family member. What strategies do they have in place to keep you connected? Now, options might include telephone calls, video chats, or even emails to check in as well. But constant contact is important as much as you can to keep tabs on your loved one and get updates from the care facility. But remember that with all of these recommendations, there's no simple answers or ways to completely eliminate risk. So even with all the best guidelines in place, risk still continues to be an issue with COVID-19. So let's talk a little bit about residential facility incidence considerations. The slide is broken into 3 different scenarios here. So when we're maintaining the person in the residence, make sure to ask the following questions. What are your quarantine procedures? What is your level of confidence that CDC guidelines are being followed? We want to make sure that best practices are in place to really limit the risk of infection from COVID-19. Ask how many people in the residence have been impacted by COVID-19, or do they have an outbreak currently happening? Most care facilities have been really good about communicating with family members as outbreaks occur, but you want to be asking these questions on a regular basis. Ask if other staff or residents or both have been affected by COVID-19, either in the past or currently. And ask if the person with dementia will be able to follow any social distancing procedures and guidelines. And maybe they'll be able to do that with or without help. In some cases, the person may not be able to walk or move on their own. So that actually can help with social distancing guidelines, being able to keep them in a more socially separated, physically distanced environment. You want to ask if the residents have both the facility itself, staff, and residents have use of personal protective equipment or PPE if necessary. Ask how many staff members interact with your family member on a regular basis. Is the facility able to limit the number of staff who work directly with your family member? That may be another way to reduce the risk, having limited number of people interacting with your loved one. Now, not all care facilities have the ability to have that direct one-to-one support with long-term or with their residents. So it's important to have a good sense of what their other precautions are that they're taking, because they're not always adequately staffed particularly during the pandemic to be able to care to provide all of these risk mitigating practices. So some other considerations. The next scenario that we'll look at here is around moving a family member to another care residence. And these have been particularly difficult situations for family members during the pandemic, if they're not getting the care that they need, or moving someone from home to a long-term care community while the pandemic is happening. Now, moving a family member to another residence may be an option if needed. However, there's no way to know whether they'll remain free of any COVID-19 cases themselves. So some potential questions to ask a potential new long-term care facility would be if they're even accepting new residents. Some nursing homes are not accepting new residents, depending on location. Ask if there have been cases of COVID-19 in this new residence. You may want to also ask many of the same questions that you would from the previous slide regarding staffing, procedures, etc. But again, even with all of these questions and procedures and considerations, there's no way to fully eliminate the risk of contracting COVID-19. So, as much caution as possible is certainly important. So let's look at another scenario here, which is moving a person back into your home after they've been in a long-term care setting. And this is something that some families have considered doing if they feel like the risk is lower at home and they can provide additional safety measures. But it's important to note that, again, there are no simple answers with this. And at this time, there's no way to completely eliminate the risk. Even moving a person back home, you still have some risks to consider. But here are some questions to consider if you're faced with this particular situation. And the answers to these questions may really help you make the best decision for your family and your family member. So ask what level of care the person really needs on a day-to-day basis. So for example, ask, is the person able to bathe or dress themselves? Are they continent? Can they control their bladder and bowel as needed? Can they use the restroom on their own? Can they move around? Are they ambulatory, or do they need assistance? Now, if your loved one's been in a long-term care community for a while during the pandemic, you may not have a full sense of their current abilities on a day-to-day basis with some of these activities. So you want to be able to ask the long-term care community that they're in those questions before you consider moving them back home. And ask, is your family member able to provide the level of care needed, or your family able to provide the level of care needed for your family member with dementia? So whether it's you as a personal caregiver or any family supports that you're going to be putting in place, you know, there are all these other considerations to know about supporting your loved one with dementia. And you need to know if you're able to provide that kind of care. Of course, you want to be considerate of anyone in your family currently having COVID-19 as well before you make that decision. Ask yourself, are there individuals in the home who work outside of the home? Maybe they're essential workers or don't have the ability to stay home and maintain isolation throughout the pandemic. So if the risk for exposure is increased, you may reconsider a move back home. And ask yourself, is it possible to hire in-home care workers, right? This option comes with its own level of risk, which we can talk about next. So let's look at activities at home. So family caregivers may need to adjust your usual routines, and many of you likely already have throughout the course of the pandemic, to care for your loved one at home. And it's important to continue to engage your loved one living with dementia, whether it be including them in regular tasks or planning activities that you both enjoy. Creating a simple daily plan is a really critical aspect of keeping consistency around the home. Spending time thinking about a schedule for that day is an important part of that, and one that really can help you make all of these adjustments a little bit easier. Focus on enjoyment, not achievement. That's a big part of this. How do you maintain enjoyment over the course of a person's time at home? And be mindful about exposure to upsetting content during the pandemic. I know we've all been subject to some difficult and disturbing news sometimes. So really trying to limit the exposure to news, particularly disturbing news and content from television shows, movies, all of that stuff. People with dementia can be particularly sensitive to. So let's look a little bit at caregiver stress, something that's very real for so many people during this pandemic. And throughout this time, you may experience some forms of stress as a caregiver. That's certainly not uncommon in the before the pandemic, and certainly true for many caregivers now. And it's so critical that as a caregiver, you make sure that you're taking care of yourself and know what resources are available to you. And physical activity can be a really important part of maintaining your mental health and well-being, right? Even just going outside for a walk or going for a swim if you can, a bike ride, staying as active as possible, maybe doing some housework or yard work, particularly now here in Southern Arizona where the weather is still really nice. And starting to consider some relaxation techniques if you haven't already done that. Maybe that's online yoga classes, some of the programs that are featured through TMC for Seniors as a great resource, meditation, or just grabbing a cup of coffee and watching wildlife in your backyard. And get help and support. That's a really important aspect, is that social isolation is very real during the COVID-19 pandemic, as we see now a year at home isolated. And that help and support is really critical in maintaining your emotional well-being as well as that for your loved one. So it's okay to ask for help. And we're going to talk pretty soon about some of the helpful resources that you can get from both our helpline, care navigation through the Alzheimer's Association, and more. But it's more important than ever that you find ways to take care of yourself, even if it's brief breaks to take a walk, read a book, or do something else that you enjoy doing. So let's talk about some of the resources that are available to you, both now and throughout the pandemic and beyond, to support you and your loved one living with Alzheimer's disease or other dementias. So let's talk about our helpline. This is just a critical aspect of the care and support that the Alzheimer's Association provides. And this Alzheimer's Association 24/7 helpline, that you see the number there, you can both call 24 hours a day, but you also have the option for live chat. Not everybody feels comfortable talking on the phone with their loved one in the house. So we do have a live chat feature now too, where you can talk with our care consultants. Again, 24 hours a day, 365 days a year, in over 200 different languages. And this free service offers access to our specialists who are master's level clinicians, able to offer confidential support for all sorts of situations and information related to Alzheimer's and other forms of dementia. So whether it's just a quick question that you have or more of an in-depth care plan that you're hoping to develop, our staff can help you with that. And you can contact us day or night. So 2 a.m. if you have a question, you can speak confidentially with our staff 24 hours a day. You can learn more about the symptoms of Alzheimer's that maybe you didn't recognize before the pandemic, but now you're seeing those symptoms set in with a loved one or even yourself with warning signs of dementia. You can also find out about our local programs and services by contacting the helpline. They have access to all of that information, and get information about legal and financial services as well. So I encourage you to use that resource. It's being used right now by over 300,000 callers annually to get access to those care and support services. And again, a free program to you. But in addition to that, we've got virtual programs, much like the one that you're seeing today. We've transitioned all of our in-person programming right now because of the high-risk population that we serve to virtual programming. So you can either see programs like this via webinar, or you can join programs like support groups by phone. And they're all available for you for free at no charge. And you can find all of that at our communityresourcefinder.org. You go to alz.org, you can find that information, or also at communityresourcefinder.org. So the slide here about the Community Resource Finder, this is an online tool. Again, that website's listed there on the slide. You can reach out for local community living services, day programs, medical services, and more. And this is a joint venture between the Alzheimer's Association and AARP, so you can also find AARP programs there as well. So really love this resource, and a good one for both those folks caring for a loved one at home or in the community who are looking for additional resources and support. Now, we also have, through Alz Connected, at this online community for caregivers and people with dementia as well, with early stage dementia, who can chat with over 50,000 members and share your thoughts and questions and ideas there on these community forums. And we also have an Alzheimer's Navigator. So this Alzheimer's Navigator allows you to create an individualized care plan. Depending on where you're at in your caregiving journey, you can click on different options, whether that's accessing a diagnosis or getting community supports, finding out how to get a loved one to stop driving if it's time to do that. All of that's available there at the Alzheimer's Navigator. So lots of resources for you for support, including TMC for Seniors, which provides incredible services here in the community. So I just want to thank you for taking the time to listen to this presentation today about these helpful tips and strategies for COVID-19 and caregiving, and know that we've got a number of different pieces of information and support on our website at alz.org if you ever need more.
Thank you so much, Morgan. I do have a couple of questions that have come in that I would like to ask as well. And it's great to have all that information on how to protect your loved one right now, particularly, it's such a challenging time. One of the questions that I have is about mask guidelines. And, if you have a loved one with dementia, do you have any suggestions on how to approach this if you do need to you are taking your loved one out in public, and maybe it's a challenge maybe to keep the mask on? Any ideas on what somebody might be able to do?
Yeah, this is a really difficult situation, right? And hopefully, as the pandemic evolves and more vaccines are available, it becomes a less of a concern. But nonetheless, even after vaccines are widely available, it's likely that the CDC will encourage masking in public. And for people with dementia who may not understand what's going on with the mask, it's important to be able to find creative ways to help them keep that on. Mirroring can often help. So if you're doing it and your loved one's doing it at the same time, that can encourage that practice. But you may need to do have some alternative ways to explain why you're masking, right? So whether that's making it a game, or maybe that's talking about keeping their nose warm. You may have to come up with some creative ways to do that, and know that it may not always be possible. And so you may need to do everything you can to mitigate risk outside of masking. And I think the most important part of that is, how can you maintain social distance with your loved one, whether that's getting some additional supports in the home so your loved one doesn't have to be out in public, or doing telemedicine visits if possible with your provider if needed to limit exposure in a medical setting as well.
Great. And I had another question come in, just asking, is there anything, do you know of anything about any kind of new meds that may be coming out that are related to dementia?
Yeah, so the one that most people may have heard about, aducanumab, is a potentially disease-modifying drug with some exciting potential to actually change the underlying cause of Alzheimer's disease. And this is one where the FDA right now is exploring whether or not the safety guidelines around that to be able to give final approval for widespread use. There's some early data showing the effectiveness of this medication in not just changing the symptoms of the disease, like we see with many of the medications available now. They don't change the actual disease, they just mask the symptoms. This drug has the possibility to do that. So the Alzheimer's Association is looking at all available data and advocating through the FDA for approval of that medication, because we know how life-changing that would be for people with dementia. It would be the first disease-modifying drug ever available for Alzheimer's disease, and we think that it offers some real hope. But we're waiting patiently to see what the FDA finally rules on this spring.
That sounds really exciting to see the difference in what that medication could possibly do. And
Absolutely.
I know folks it definitely would be life-changing.
Mm-hmm.
Can you share a little bit with us again, Morgen? I know you briefly mentioned it at the top of the presentation, just about, I know you have your caregiver support groups, which are running by phone, but sounds like they might be transitioning soon, maybe over to Zoom, which will be great. We do offer that program over here at TMC for Seniors. And you can call us for information on that if you are interested in joining. Our next caregiver support group is Thursday, March 18th at 10:30 a.m. And there is information on our website for that. But I wanted you to share more about the Music Jam program. And so if you could, because that is such a fun program that you could do with your loved one at home. So. Yeah,
absolutely. And so our Music Jam program, and I just want to give a thanks to TMC for Seniors for partnering and providing support for that program, because we know how critical social engagement is. Even before the pandemic, when the program launched, and we'd have 20 people in a room side by side playing music, and we really hope to be back to those days sooner than later. But nonetheless, now in the pandemic, with social isolation being so real, social engagement is really critical. And even if we're doing that virtually, being able to connect with people and do something fun where dementia is not the topic of conversation. We're there to play music together. We have amazing musician that joins us each month, second Tuesday of each month at 11 a.m. For this virtual music jam. And there's live music that's played there. We'll be doing some instrument creating and instrument building at our upcoming music jam. So excellent opportunity to stay connected with others that are living with the disease, but not having to actually talk about it. So if you're interested in that program, certainly you can always reach out to TMC for Seniors and the Alzheimer's Association too for more information.
And if they, and this program is designed for early stage dementia, correct?
Correct. Yeah. So we're looking for people who are in the early stages of the disease, who are willing to participate. Now, we do have social engagement activities for people that are farther advanced as well. So definitely reach out to us if you're looking for those resources as well.
And if anybody is looking for any additional information from today, you can certainly contact the Alzheimer's Association, the Desert Southwest chapter. The phone number is 322-6601. We do have it scrolling at the bottom of the screen here for you as well. So it is a fun program. So I encourage anyone that might have some interest to contact the Alzheimer's Association regarding that program and get you registered. It's a really neat, different way for engagement. So we appreciate that partnership. So thank you very much.
Thank you.
Yeah. So I think that is all the questions I had for today, Morgan, that have come up. I just want to thank you so much for being here to really shed some light on this important topic. And we hope that we're able to help some families out there during COVID to learn how to stay connected and be safe, and take care of themselves as well as a
Absolutely.
caregiver. So thank you so much. Folks, we'll be on again next week. On Tuesday, March 16th is our next presentation. And this is Brain Month, so over here at TMC for Seniors. And we are going to be talking about eating for brain health. So if you're interested in that, please give us a call at the office. The phone number is 520-324-1960. Thank you again, Morgan, for being here today.
Thanks so much, Maya.